Hello, my name is Talisha Archambault, and I am your health education specialist. This video is part of our Safety and Emergency Preparedness series, and in it we're going to discuss workplace violence. Workplace violence is the abuse of staff by other staff members, residents, or visitors. This includes verbal aggression, physical aggression, and sexually inappropriate behavior or speech. We do not tolerate the abuse of staff, so it is important to report any threats or actions that you see or experience right away. There are several risk factors that increase the likelihood that someone will be abusive. Of course, these traits and stressors are not a certain indicator that someone will show aggression, but these are important things to be aware of. Abusers often have a history of previous violence, and they may have previously been a victim of domestic violence. They are statistically more likely to be male. Substance abuse, mind-altering medication use, and new or obsessive interest in weapons may also be indicators. Life pressures like job frustrations, stress, personality clashes, and financial problems can also indicate that someone is more likely to become aggressive. Medical conditions like pain, depression, dementia, and cognitive impairment can also suggest increased risk, especially if there are also factors like schedule changes, crowding, rushing, new employees, or sudden awakening. Unfortunately, agitation is not uncommon in dementia. Dementia is an umbrella term for any of the several types of brain changes that result in problems with communication, reasoning, thinking, remembering, and eventually self-care. Alzheimer's disease is the most common type of dementia in elderly people. There are 3 stages of Alzheimer's disease: mild, moderate, and severe. The symptoms of dementia will vary depending on its type and stage. Agitation is a symptom of the middle stage. Other symptoms that could contribute to aggressive behavior are confusion, delusions, social withdrawal, wandering, suspiciousness, and frustration. So what can be done to avoid violence? A strategy called de-escalation is an appropriate response if you notice another person starting to become agitated. De-escalation techniques are used to reduce the intensity of a conflict or possibly aggressive situation. The goal of de-escalation is to help calm people down to avoid a harmful situation. The following are some helpful de-escalation techniques: active listening, empathy, remaining calm, and meeting needs. The first de-escalation technique is active listening. Most people want to be heard and understood when they are upset. Active listening can help to calm a tense situation if the person feels that what they're saying is meaningful to someone else. You can do this by repeating what the other person says back to them. This can show the agitated person that you really want to understand why they are upset. The second de-escalation technique is empathy. Empathy can help to de-escalate a potentially aggressive situation if a person feels supported. Empathy can be shown by stating that you can see why the person is affected by the situation and that they have every right to be upset. This support can lead to an offer to help the person find a solution that is peaceful. The third de-escalation technique is remaining calm. Communicating calmly is very important during de-escalation. Maintaining a low and calm tone of voice helps to keep the person from becoming more panicked or agitated. Remaining positive that a peaceful solution is possible. Raising your voice or talking over the upset person can further increase the tension. The fourth and final de-escalation technique is meeting needs. This can be helpful in a tense situation. If the upset person is a visitor or other staff member, you can offer to assist them in finding the answers they need or the right people to talk to. If the upset person is a resident that has confusion or dementia, Try to look for key words that could point you toward a potential unmet need. For example, if the resident is upset and yelling about the heat being broken, we can get them a sweater or lap blanket and turn up the heat in their room. De-escalation should only be attempted if the upset person is not actively being violent or threatening a life. There are 3 recognizable stages of workplace violence that you should know so that hopefully you can report your observations before a violent act occurs. The first is abusive language. This can include name-calling, spreading rumors or lies, making sexually inappropriate comments, degrading others, or using profanity. This behavior should be reported right away to your supervisor before the second stage has a chance to happen. Your supervisor will then notify your administrator, who is also your abuse coordinator. The second stage is threatening. These are statements that a person intends to harm someone. Any threats should be immediately reported to your supervisor. The final stage is a violent act. If a situation escalates to violence, remove any residents from the area if safely possible. Remove yourself from the area if safely possible. If you witness a major violent act and can safely do so, alert the police. If it is unsafe for you to move away from the upset person, put your hands up with your palms toward the person to appear as non-threatening as possible. Speak calmly and attempt to de-escalate the situation using the techniques we previously talked about. The best way to address workplace violence is to prevent it from happening. You can prevent workplace violence by recognizing and reporting signs that a person is becoming overwhelmed or hostile.